Hey guys, today we are going to be doing your respiratory model, which is like the 3D respiratory model. This part can get confusing because there's an upper and a lower, so the numbers get a little bit confusing. So today I'm going to show you guys where everything's at so you can kind of get a good understanding of the model as a whole and as pieces rather than just getting confused over all of the different numbers and all that kind of thing. So here we have our whole model, and as you can see, these pieces come off. So this would be the upper respiratory, and then these come apart as well. And then we have our lower respiratory, and then our lungs, which come off as well. And then there are labels on this side as well as in here. So make sure you take those off so you can see all of the numbers, because if not, you'll be missing a couple. There's also labels down here as well. Okay, so number one on your lab manual will be the hyoid, and then number two will be the thyroid cartilage. Number three is the cricoid cartilage. Now I have it opened up, and right here you will see number four is the epiglottis. This would be the epiglottis on the other side, but it is only labeled on this side. And then if you take this one and flip it over, you will see number five is the arytenoid cartilage. And then if you flip this one over, you will see that number six is the thyrohyoid membrane. And then number seven would be the thyrohyoid muscle. Number 8 right here would be the cricothyroid muscle, and then if you flip it back around, number 9 right here is the transverse arytenoid muscle. Number 10 is the oblique arytenoid muscle, and then number 11 is your posterior cricoarytenoid muscle. Now we have flipped both of them back over, and number 12 right here is going to be your vocal fold or vocal cord. Here it is when it's all together. Now we'll come over on this side, and number 13 is going to be your superior laryngeal artery. And then you'll come over to the below respiratory model, and you'll see number 14 is the inferior thyroid vein. And then you'll come back over here, and A is going to be your inferior tubercle, and B is going to be your thyroid gland right here. Okay, so like I said, the lungs come off over here, and you can also take the heart out and then open up the heart like this. Now you see I have taken the lungs and the heart out, and you will find number 1 right here, which is your carina, which splits the left and right bronchus. Number 2 is going to be your right primary bronchus. Okay, now we come to the top. As you can see, I have taken the upper respiratory off, and you come down to number 3, and that is your right subclavian vein, and then 3A will be your right subclavian artery, and then number 4, which is up here, will be your right common carotid artery, and then number 5, which is right here, will be your right internal jugular vein. Coming down from these up here, you will go to number 6 and find your right brachiocephalic vein, and at number 7 you will find your brachiocephalic artery. So we have seen all of this in the neck area, and then you'll come down. So the heart goes right here, and you will take that out, and over here you will find number 8, which is going to be your pulmonary artery. As you can see, I have put the heart back in, and you will find on number 9 that this is your left ventricular, the surface of it, and then you will go to number 10, and that would be your, on the lab book it says ascending aorta, but this in general is your aorta right here. Now, as you can see, I have taken the top part, this part, off of the heart, and I will come in to find number 11, which is right here, and this is your aortic semilunar valve. As you can see, it goes from the left ventricle through the heart. Now we will come to number 13, which is going to be your left atrium, and if you look at the cover, and it goes back on like so, number 14 will be your left auricle. Taking the top of the heart back off, you will find number 15, which is going to be your bicuspid valve. Now that the top of the heart is back on, you will find number 16, which is your ventricular myocardium, and then number 17, which is your pulmonary trunk, which would be this right here. Taking the top of the heart back off, you'll find a number 18, which is your pulmonary semilunar valve. So it comes from the right ventricle and goes all the way into the pulmonary trunk. Now with the top of the heart still off, you'll find number 19, which if it'll focus right there, it kind of looks like a G, but that is number 19, and that is your right atrium. Now at number 20, you will find your pectinate muscle, and then number 21, you will find your superior vena cava. Now the inferior vena cava, like the 3D heart model, is on the back side at the bottom. Number 22, that is the inferior vena cava, so you just take that heart out and then place it right back. Now with the top of the heart back off, you'll find number 23, which is your tricuspid valve, which leads from your right atrium to your right ventricle. And then if you come over to number 24 over here, this is your pulmonary vein. Now onto letters. In your lab manual, there will be capital and lowercase letters, so I don't want you to get confused, but we'll start off with capital C, which is right here, and this is your trachea. Now I have taken the heart out of the model, and you will find capital D, which is the esophagus. Now I have put the lungs back on the model, and you will find capital E right here. Just zoom in, capital E, and this is the apex of the right lung. Now you will go to the heart, and you find F, which is the labeling for the heart. And then you will go down, and then capital G right here, this whole thing is your diaphragm. Now your lungs are going to be different on your right and left. On your right, you're going to have 3, and on your left, you will have 2. This is because of the heart being more towards the left side. And over on the right side, you'll find a lowercase a, which is the superior lobe of the right lung. And then you'll find B, lowercase b, which is the middle lobe of the right lung. Then you will find here at the bottom is lowercase c, which is the inferior lobe of the right lung. Now on the left side, we do not have a middle lobe like we do on the right. We only have a superior and inferior. Now lowercase d will be the superior, and lowercase e will be the inferior of the left lung. Like I said, there are many different parts and models on this one model. There's the heart, there's the upper respiratory. You can take apart the heart, and then you can take off the left and right lung, which can make it a little bit confusing. So I hope this video helped you guys to kind of understand where things are at and not be searching for things and all of that, because this is a very complicated model, but it doesn't need to be. So just take your time and look and practice, and I promise you will get there.